Hi, my name is Dr. Gerald from Elite Dental Group, and I'm happy to answer any of your dental implant related questions. I can think of several factors, but to allow me to explain better, I will go back to my model. The implant comprises of three parts, as I mentioned earlier: the implant itself, the abutment, and the crown. So the first part that's actually placed in is the implant. And the biggest factor in this stage of the treatment would be the skill of the surgeon, as well as the detail of the treatment planning. If the implant is placed in the gum and in the bone in a wrong way, or if the implant is malpositioned, or if the implant is placed in an area where the bone is too thin, then the longevity of the implant is really compromised. That's even before getting to the abutment or the crown. So surgically, the skill of the dentist or the surgeon, the treatment planning, the indication of the surgery would go a long way to ensuring the longevity of the implant itself when it's surgically placed. Then after the surgery, we move on to the prosthetic components, which is the abutment or the crown. And these components are actually made in the dental lab. They're not usually made by the dentist. So the quality of the dental lab also matters, because these are actually custom-made components that are like a screw within a screw. So if you can imagine, if the screw or the abutment isn't made well, and if there's a poor fit, or if the crown isn't made to have a proper fit, all these things would lead to failure of the prosthetic component. So there are two main factors, broad factors, which is the surgical factors for the implant, as well as the prosthetic factors for the ceramic crown and the abutment. And these factors really affect the total longevity of the implant. So when the dental implant fails, several things can be done depending on where the failure lies. If the failure lies on the prosthetic components, which is the crown or the abutment, then it's a simple matter of removing the crown or removing the abutment. And when the broken parts are removed, we just make an order in the dental lab for new ones to be made. So when a new abutment and a new crown is made, it's usually a simple matter of just installing it into the implant. However, if the implant fails, if the implant does not integrate well with the bone, if there is a massive gum infection around the implant, or if the implant is somehow destabilizes, or if the implant is broken under heavy load, then it's more of a hassle. Usually there's a surgical procedure to remove the broken and failed implant, and the bone graft is placed, and a healing period needs to go by before a new implant is attempted. So the failure can occur at the abutment or the crown level, or the failure can occur at the implant level. Crown and abutment level failure is much easier to manage, but failure at the implant level is a headache, and that usually involves some kind of surgical procedure. So in conclusion, dental implants aren't as straightforward as many people think. A lot of factors need to be considered before a patient is declared fit for the surgery and before we can actually take informed consent. There are cases whereby we do implant surgery in compromised sites, where the bone is too thin, when the gum is too thin, and in cases like that, we always warn our patients that there is a chance that the implant will not last as long as it's intended for. As long as patients make an informed decision and their expectations are managed, then I think we've done a good job. However, on the other side of the spectrum, there are implant surgeries that can be done very simply with not much complication, with very high success rate. So it really depends on the patient, the unique circumstances of the patient, the unique circumstances of the surgery site, how healthy the bone is, how healthy the gum is, whether there's a stability in the bite. There are many factors that a good dentist should discuss with their patients before actually attempting any kind of surgery. So I hope you find that information useful, and if you do need dental implant surgery, please find a good dentist with good experience in the surgery and have a good deep conversation with him.